Hello, this is Isabel Galliano, and I am the co-founder of The Cancer Coach. And our mission is to support cancer patients and people affected by cancer throughout their healing journey. As a cancer survivor myself, I know how important it is to feel understood, but also to have the access to the right information and have very practical guidelines to help through these challenging times. And in that spirit, I organize every week a live talk where I have incredible guests and we talk about cancer-related topics. Our aim is really to shed information, to shed awareness around cancer, and to make people more at ease around the topic. And today I chose to talk about mastectomies. I understand that this is a very delicate and difficult subject to talk about, and it is feared by so many women. But I do believe that it is important to start talking about it, and the more information you have, the better you will be in a place if you need to deal with that. So I'm very happy to have as a guest today Dr. Andrew Lee, who is a breast surgeon. Welcome, Dr. Lee.
Hello, hi everyone. Good morning.
Good morning, and thank you for joining us. So, Dr. Lee, as I mentioned, talking about mastectomy is a delicate topic, and every woman wishes never to be confronted by it. But the reality is that 1 in 8 women will face a breast cancer diagnosis. And I truly believe that it's important to start talking about these topics and to try to kind of, when you have more information, it's just easier to make a decision, and it takes also a little bit away the fear factor. So I wanted to start by just reminding women and encouraging women to do their regular self-breast checkups and to not forget to do their regular screenings. This is really very important when we talk about breast cancer. And then, if there is a lump that is detected, go please and have it checked. And I also want to remind women that mostly it is not a cancer. So it's not immediately a reason to be alarmed, but it is still very important to get it checked. And then, Dr. Lee, if you don't mind to guide us a little bit through the procedure. So when there is a lump detected, either by a woman who feels it or through a screen, usually or very often a biopsy might be recommended.
Yes, thank you very much, Isabel. Well, when a lady discovers a lump, first of all, please don't go into the panic mode. Most likely it is benign because there are lots and lots of different types of breast lumps. But what you don't want is to assume that that is going to be okay. What you said about regular screening and monthly breast examination is crucial. And I think that self-examination is even more important because for mammograms, it is once every year or 2 years or 3 years, depending on where you live. So therefore, anything can occur in between times. And so therefore, the monthly examination, in my opinion, is even more important than the screening itself, the actual mammograms and ultrasound. So when ladies
get women to be familiarized with their breast and their breast tissue, and to not be shy, to touch it, because they will feel as soon as there is something that is not that has changed, and then there is important to intervene.
Yes, it's also important because that's how you normally, well, if you examine yourself regularly enough, and you will know what's new and what's not, shouldn't be there and things. But when ladies do come to see me with a breast lump, what we do is what we call a triple assessment. We take a family clinical history and a clinical examination. That's the clinical part of the triple assessment. That's here to identify there may be something in someone's medical history. For example, if people who had radiotherapy to the chest because of lymphoma, they are at increased risk of developing breast cancer. So therefore, it's these tiny little things that we need to know. After that, we tend to do the imaging, the radiology. That's the radiology. So that's the mammograms and ultrasound. But a lot of ladies do ask me, well, which is better, mammograms or ultrasound? I rather like to compare mammograms and ultrasound as salt and pepper. They kind of work together with itself because they look at the breast in a very different ways of looking at the breast. So therefore, it gives you a more complete So it's not one against the other. So it's not like, you know, Heinz ketchup or and another brands of ketchup, you know, which one is better, but it's more of a salt and pepper. And after we've got the information, then we proceed with the pathological assessment, which is basically to find out what this lump is. Because the X-ray doctor and myself can tell what we think it is, but to know exactly what it is, we need to look at it under the microscope. And the gold standard way of doing this is to do what we call a core biopsy, which involves giving you an anesthetic injection, just like going to a dentist. So you'll feel the doctor touching you, moving you, but no sharp pain. And then we make a tiny little hole in the skin, about 2 millimeters, and we have a needle that goes in to take strips of tissue out so that we can have a look at it. We don't want to just look at the cells. We want to look at the cells in relation to each other, and this is the most, the least invasive way of diagnosing. The important thing is we need to know, because there are lumps sometimes that you feel and you look on the mammogram and you think, oh goodness, this is a cancer, but it can turn out to be benign. Whereas there are lumps that you feel, okay, this is benign, there's nothing to worry about, but actually turn out to be cancer. So,
yes. And I think it's a very important point that you make there. And I have every day, you know, women that would reach out to me and tell me that there has been a lump found in their breast. And they would say, well, why do I have to bother to go to biopsy? I want to get it out. You know, why should I even go to biopsy? Why can't they just take it out? And I try to explain them, you know, there is a reason why doctors need to perform a biopsy, because it gives them very important information on the plan ahead.
Yes, you're absolutely right there. First of all, there are different types of lumps, and some lumps you can leave them alone. For example, a fibroadenoma. Sometimes a lump can be a cyst, so it's just a water cyst. For that, we just basically put a needle and syringe and remove the fluid out, and the whole lump disappears. You know, there are some benign lumps that needs to be removed, and removing a lump can be different depending on what type of lump. For example, if it is a fibroadenoma, you can just remove the lump itself. There are some benign lumps like a phylloides that you need to actually remove it with a rim of tissue around it, because these lumps can come back if you don't remove it cleanly. Whereas for cancer, then we usually remove the lump with a bigger margin, and also we want to remove some lymph nodes to look at to see if the cancer spread to the lymph nodes. And so therefore, if we remove the lump straight away, then there's a high chance of a second operation, which is not good.
Yes, exactly. So I think that's an important point to make, you know, that there is a reason why the biopsy is asked, and I would always also encourage it. But sometimes I get clients who tell me that their surgeon said, you know, you can just go ahead and have the lump removed, but I do encourage a biopsy. And anyway, in that sense, I also always encourage a second opinion, because I have really learned in my many years working with cancer patients and going through cancer myself, that it's not always black or white. And often different doctors have a different approach, different surgeons have a different approach. And I think it's good for you to understand what are your different options. And another thing that I wanted to point out is, because for me it's really important to put this talk in the perspective of the surgeon, but also of the cancer patient. And I mean, you know, I have had breast cancer, I have multiple surgeries, and I think it's important to see this both point of view and how a cancer patient feels also emotionally, this roller coaster, you know, that you go through. And one of the feelings that you often get when this journey starts is a sense of urgency. So you are put in a situation like you need to get this surgery done like by today. And often, of course, there are exceptions. You do really have the time to take a few days, even sometimes a few weeks. Again, it depends on every situation to get a clear view. And I always encourage women to do that, because when you rush through such a procedure, you know, I feel that the emotional setbacks are always stronger. You will always think, oh my God, was there maybe another option? Did I really do everything, you know, to get all the information? So I encourage women, unless it is a specific cancer that is particularly inflammatory and aggressive and needs to be removed immediately, usually there is time to do your homework, to gather the information, to go for a second opinion, a third opinion, if you have the possibility and the access to it. And I really feel, and I have experienced it with myself and with my clients, that if you go into a surgery with a clear mind and you are convinced that you are in good hands, first of all, that's the right person to do the surgery with, and that it's the right procedure. It's just the recovery process emotionally is much, much easier.
Yes. Well, I think, again, this is what I totally agree with you on this. The reason is because ladies, the majority of ladies will survive breast cancer. And we know it because as a breast surgeon, as you have a practice, as you allow time to grow on, the practice becomes more and more busy because of the cancer survivors. They keep coming back year after year. And so if you look at, when I talk to some ladies 20 years on from their treatment, they'll forget their chemo. They remember, yeah, I remember I had to have some chemo. And also I had some radio, but they can't remember the exact things that had happened. But the only thing that will constantly remind them is the surgery, because every morning they look at themselves. And I have ladies who don't want to look at themselves below the neck because they don't want to see it. But and so therefore choosing the right operation is very, very important. There's no blue light emergency, but an extra day or two doesn't cause any problem at all.
Yes, and I appreciate that you stress that, because as I said, many women feel the pressure of time and might have regrets afterwards. So take your time. And then, if you don't mind, so what are the different possibilities? Of course, I understand every cancer is different, every body is different, every breast is different. So there is no general rules. But if you can guide us through, like, kind of the best case scenario, you know, when it's a cancer that is quite controlled and that it's a minimal invasive surgery, how would the procedure work? And also, importantly, what are the characteristics that you have to take a decision on what procedure you are going to recommend?
Right. Sure. First of all, my advice is really as much as to keep your own breast, not to go for a mastectomy, but there are always situations where a mastectomy is indicated. If what we do know is one very important that people tend not to remember is that it doesn't matter whether we do a lumpectomy, that's just removing the cancer with a rim of normal tissue around it, or do a mastectomy. Survival is exactly the same. A lot of people think, if I have my mastectomy, I might do better in terms of my survival. But we know since the 1970s, when I was still a schoolboy, the professors who used to teach me, they were doing these kind of research, and they found out that whether you have a mastectomy or a lumpectomy, as long as you have all the treatments prescribed, survival is pretty much the same. And if you think about it, it's true, because the surgical principle is to remove the cancer with a clean rim of tissue around it. That's basically, we have to remove the cancer and the precancerous change. So therefore, as long as that's cleanly removed, the rest of the tissue are normal. So removing normal tissue doesn't actually improve survival. It's like if I have a problem with my little finger, I can either cut my little finger off or I can cut my hand off. So obviously the choice is simple. You know, I'm not going to cut my hand off. So just in the same way, we, as a breast surgeon, we try to preserve the breast as much as we can.
I think that's really an important point to make, you know, because there is this kind of myth around, and many women believe it, that going for mastectomy puts you at lower risk of a recurrence, and they are keen to have the radical surgery because they believe that it's better for them. So it's important that you stress that, you know, that studies have found that no, that a lumpectomy, as you said, removing all the margins, has the same effect in that sense than a mastectomy.
Yes, and so how do we decide mastectomy or lumpectomy? It's very simple. For example, it's down to the size of the cancer. For example, if I have got a lady, if we have a cancer that's 5 centimeters, but in a lady with very small volume breasts, so by the time you remove everything, there's going to be a big defect which is impossible to fill. And therefore, if we just do that and have radiotherapy, then this lady will end up having a lot of deformity. However, if you have a 5 centimeter cancer, but in a lady with very large volume breast, so by the time you remove it, it's even what the amount that you're removing is less than, say, 5–10%, then you can still have enough breast tissue to repair the breast nicely so that there's no deformity. And so this is really the deciding factor on it. And again, this comes into early detection, because the earlier the cancer we detect, the more options there are. For example, if you've got a small cancer, you can preserve the breast. In some ladies who have a large breast, they want to get it reduced, you can do the cancer surgery along with the breast reduction surgery. And also, there are now techniques that, even if you've got a small breast, if you want a lot larger breast, you can also have it at the same time, So there are different options, but detecting it early will give the lady the most options, and that's one thing.
So there's still this common fear, and I have to say that I went through it myself. So when I was I got the diagnosis of breast cancer, and there was this discussion, what should I do? In my mind, 15 years ago, and ignorant in that topic, for me, a mastectomy was a complete kind of cut off of a breast. In my mind, I imagined it like a completely flat chest with just a scar. So does that still happen? Is this the only way? And how does that work?
Right. Okay. Well, there are different terms and things. So the reason why we do how we do a standard mastectomy, or what we call a simple mastectomy, is when we remove the breast tissue. But if I remove all the breast tissue, then you have a very saggy skin, and so therefore, wearing a breast prosthesis would be very difficult, because to wear a breast prosthesis, you need to have a very flat chest. So that's why we make it as flat as we can, so that the lady can wear the mastectomy bra and the prosthesis can wear it nicely. Also, when I do that, I also remove the tissue in the underarm pit, because if I don't, then there will be the extra tissue in the armpit will form it feels like having a handbag in between your elbow, your shoulders all the time. So that's how we do it. That's what we call a mastectomy. Of course, nowadays, reconstruction is even more common, because more and more plastic surgeons are being trained, more awareness, and there's also more funding for reconstruction. Then what we do now is, if a lady wants to have a reconstruction, then what we try to do would be a skin sparing mastectomy. That's basically to remove the breast tissue, just the breast tissue, and the nipple, leaving the skin envelope around. And then we do the immediate reconstruction. Basically, the plastic surgeon will then put in either your own tissue or an implant to replace the lost volume. And that's what we call a skin-sparing mastectomy. Sometimes some ladies do want to have their nipple preserved, because it is, again, it's part of our body. We can never underestimate that. So in the appropriate ladies, we can also preserve the nipple as well. So at the end of it, I had some ladies who went at the end, you wouldn't even know that they had a mastectomy.
I like to explain it. If you are lucky enough to be in a position where you can spare the skin and the nipple, I like to explain it in a way that it's almost like a pillow, where you take out the inside of the pillow, and then you replace it with another material. But the pillow, the outside of the pillow, still remains the same. And in such a procedure, actually, the results are really very nice and very beautiful. And it's not that shocking for the lady, and it's emotionally also much easier. But this is not a procedure that is possible for everybody, right? Depending on the type of cancer.
Well, I think that's the important thing, is that if a lady doesn't need well, it's only when the lady needs the mastectomy, and to preserve the skin, you need to make sure the skin is okay. So that's why some ladies who have locally advanced breast cancer, i.e. the cancer is affecting the skin, sometimes what we do is that we do the chemotherapy upfront first to help to control the inflammation, that the skin changes, and sometimes these will all reverse with the chemotherapy first, and then after the chemo, then we do the surgery afterwards.
Okay, and then how about reconstruction? I understand that for some ladies they can have an immediate reconstruction, so it's basically the same surgery. You have, yes. I mean, at the same time you have the removal and immediately reconstruction, which I find it's emotionally again much easier when you wake up and you still feel a breast than waking up and you feel that void. But it's also not always possible. Some women have to go to a second surgery.
Yes, well, certainly that depends, and that's the reason why it's important that as a surgeon myself, I work closely with my oncologists and my plastic surgeon. So it's not just simply writing a letter to say, dear Dr. So-and-so, can you please see this lady regarding breast reconstruction? When I write a letter, it's more of what's been going on, what treatment a lady already has given, had already received, what is the surgical plan, and what's going to happen afterwards. So based on that, then the plastic surgeon will say, oh, okay, well, you may need radiotherapy. So maybe rather than advising an implant reconstruction, maybe using the own breast tissue, your own tissue, maybe from the tummy or from the buttocks would be the more durable. So it's the importance of working as a team. Yeah.
And then, but there are also cases where you really strongly recommend for mastectomy. I understand when you have, for example, a cancer recurrence in the same breast, that yes. I mean, it's almost the only way to go to a mastectomy, and then also depending on your gene history, if there is a gene, particularly a breast cancer gene detected.
Yes, certainly there the mastectomy, the indication, as well as the amount of the tissue removed versus the breast volume is a main decider for mastectomy. The others would be, as you said, the familial history, the gene, those people who are tested positive for the BRCA gene. There are lots of other genes, but also strong family history is also an important factor, because with gene testing, we're only testing for certain mutations that we already know that causes the breast cancer. But then there are also other mutations even within the BRCA gene, because the BRCA gene is a very, very long gene. It has lots and lots of DNA, and so there may be other areas that has a mutation that can cause cancer, but we don't know. If we don't know, then we cannot test. So therefore, strong family history is also a very important factor. Together with the BRCA gene, and also those who are at risk, like for example, those who already had radiotherapy treatment for when the chest for lymphoma, those again would be advisable to have a mastectomy. Yeah.
So there again, I understand that it's important not to rush through the procedure, but have this discussion with the patient and really understand what is their family in this history. Have the time to have this discussion with them, to gather all the information, and then to inform the patient, on the risks. What are the risks, if you don't go for a mastectomy in those particular cases, and how much can you reduce your risk if you go for the full procedure. Now, I understand in terms of recurrence that, and that's again something that I'm familiar with. So I had first a lumpectomy done when I was 32 years old, and I was very, very happy that I hadn't have to go to mastectomy. But unfortunately, 2 years after I had a recurrence in the same breast. And naively, I thought, okay, we're going to go to the same procedure again, remove the lump that was extremely small, but it was very clear that was not an option for me. So because it was a breast recurrence and because it was a radiated breast, there was radiation done, the only option I was told was to have a mastectomy from that side.
Yes, unfortunately, yes, recurrence can occur after lumpectomy, and the risk of it is quoted usually 1% per year for the first 10 years. However, these are kind of quoted from the yesteryears, but now we are more quoting towards less than 1%, maybe between 0.5 to 1%. For mastectomy, the recurrence rate is maybe about less than 0.5%. So if you're looking at absolute terms, yes, lumpectomies, the recurrence rate is higher than mastectomy, but then again, it's not significantly high enough to say to all women that you must have mastectomy. Yeah.
And so I don't want to imply at all by that I did have a recurrence because I didn't have a mastectomy. I'm not saying that at all. I just want to inform women that if there is a recurrence, that unfortunately lumpectomy, it's not possible in my understanding. So often then there will be the recommendation will be to have a mastectomy done. And why is that so? Why can't you just remove the lump a second time?
Right, okay. Well, the reason is because you cannot give radiotherapy twice. Same area. You can only give radiotherapy to the breast once. So therefore, if we just do re-excision, then there may be a risk of the cancer from coming back. But saying that, it was this kind of way is quite old in a sense, because at the end of the day, but what's the risk? Sometimes I do want to know what is the risk. If I had a breast cancer, had a lumpectomy, had radiotherapy, now I've got recurrence. If I remove that area, what is my risk? And if the risk is again low, then well, I just want to do it. So again, it needs to be discussed with the individual. For some ladies, 1% risk is too high a risk. But if you talk to a banker like my brother, 40% is not a risk. It's a sure win. So
I like that you put it that way. That at the end, the decision is with the woman, right? But it's to get that information and to get it right. For example, in my case, I was presented it at there is no other way. There is no way that you will be able to escape this. You have to go through this. And I think it's important to have this discussion and evaluate the risk. And at the end, it's the woman who needs to take the decision, how much risk is she willing to take. And I also want to say that the other way also happens, and I have that, again, very often with clients of mine, that they don't need to do a mastectomy, but they say, I want everything out. I feel like it's just a danger zone in my body. I feel uncomfortable. I rather have it out and peace of mind. Is that something that you also encounter?
Yes, certainly. I have met ladies who think that breasts are a time bomb and they were never going to, because at the end of the day, people will survive. And I want people to survive well, back to their normal, doing the crazy things like jumping off, do free skydiving and things like that, or go trekking in, I don't know, some jungle or some desert, So getting back to their life is important. And the fear of the cancer coming back can sometimes be a lot to some people, but to some it's not. So therefore, it's not for me to judge whether you should have it, or because the lady is themselves are the best person to understand themselves. But what I do urge is that if people do select a mastectomy, often I would tell them, look, just have a think about it very hardly. Because when people are diagnosed to have breast cancer, the first thing is that they will just try to dive for cover. It's just like when you're going out on a patrol and someone's starting to shoot at you, then the first thing is you dive to the ground and make a decision straight away. So I had one lady who was diagnosed breast cancer, can have conservation, but because her sister had breast cancer, had mastectomy, did very well out of it. She is in her elder years, and she's not going to have another baby. She's not going to breastfeed. And she said, "Doctor, please just remove it." I said, "But you don't have to." But then she said, "No, no, no, no. Well, no, 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 no. Everyone's telling me that I need to have it removed." Okay, so I removed. We did a mastectomy. She was very happy initially, but when she came back 6 months later, that's when the depression kicked in.
Oh.
Yes, and she thought, well, I probably wish wouldn't. No, if you did rewind the clock, and she did say, look, if I rewind the clock, that was a very conscious decision. But, however, once the treatment is over, when the heightened alert is gone with the treatment, then other things can sink in.
Mm.
It's the body image. She was actually quite elderly. She's in her 70s. People would probably say, well, you're 70s, you don't need your breast. But actually, no, we're as young as we feel. And it's a part of our body. It's important. So therefore, she continued to be depressed. And the worst thing is that with this depression, other things that didn't usually bug her, now it's becoming a problem as well. So it leads on to other things. So my advice is for ladies, that's why I never rush my ladies to do anything. Have a think about it. Talk to the family, talk to the friends, and decide. But it is very big implication, even if we do breast reconstruction, because the reconstruction can look absolutely beautiful, but sometimes it doesn't. It's still not your own breast. So therefore, if it's preservable, if a lady can preserve the breast, please think twice before they decide on mastectomy.
Yes, and it's very true. It's so individual, and again, like in everything, and also everything we do at a cancer coach, everything in our mind is everything is individualized. It's not a one-fits-all approach. Everybody has a different journey, a different history, different trigger points, and it's so important to get to know who is this person in front of you, and to advise on a very individualized and personalized approach. Because as I said, I have also worked with many women who feel such a sense of relief. And I have to admit for myself, I also felt an immense sense of relief when it was out. And some, as you said, will have more depression because of the look, and some will be very much depressed with this constant fear. Although they know that the risks are minimal, they just can't, can't break out of it. They live in constant fear. They want to have constant checkups. I have ladies, who tell me, you think I can call my doctor and they can do another scan? I just want to make sure nothing has grown back. And the life is really determined by this fear. And they go from one scan to another. And then they have a moment of relief, and then the fear starts again. And so again, it's important to understand the psyche in that moment. And I have seen women that have felt a really big sense of relief, like the danger zone is gone. I can get finally back to my life. So again, it's very individualized, and I appreciate that you take the time with your clients to really get to the bottom of it.
Mm-hmm. Yes.
And then another very important aspect, I believe, is what happens after. So there is, of course, a period of recovery. So what can women expect in terms of recovery of a lumpectomy, and then the recovery of a mastectomy?
Essentially, recovery is actually very good. As a breast surgeon, I always get laughed at by my colleagues, because they keep saying, "Doctor, when are you going to do a proper operation?" For doing a proper operation means that you go into the tummy, or you go somewhere deep in the body to take something out. So, but I must say, breast surgery is nothing to be really fearful. We are only removing some lumps just under the skin. So most ladies will recover very, very quickly from the physical point of view. More importantly is really the psychological, the point of view, or rather emotional, because at the end of the day, my job is not done, or all the doctors' jobs are not done until a lady has settled, had to completely go back to their normality, and that's the thing that I would like to. It's difficult as a surgeon, because I'm only just there to do the operation, but it's actually getting back to normality is very important. And that's, I think a lot of times is underlooked. And in a way, I'm glad to know you, Isabel, for doing this cancer coaching. Because otherwise, I do have some ladies in the past, where can they go to? Of course, there's also Breast Cancer Foundation. I'm glad that they have that now in Singapore. So I think that increasingly this is becoming an awareness. It's about how to accept the past and how people can move forward. For example, ladies unfortunately may have to have a mastectomy. Sometimes how they can get back to the normality. Go back to the gym. Go and do some yoga. And life has to get back onto that. People have to go back to these things. Otherwise, I don't think. So anyway, So I think,
but it's an important point. It's an important point to raise.
Yes.
Yeah, and I feel, a lumpectomy is definitely, talking from a patient's perspective, and having had it myself and having seen many clients who have had it, it's usually very easy to recover. It's a little bit of bruising, and you really get back to your life after a few days, to be honest. A mastectomy is a little bit a different story, because there is more pain involved, there is a little bit longer recovery involved. And what I also have found that is so helpful is, to guide women to having the right exercises to do after mastectomy. When I had my surgery, nobody talked about physiotherapy or massage or lymphatic drainage and all of that. It was like, you go back home and recover. And I think that there are many techniques nowadays that really help a better recovery and keep it moving, having the right movement. I think it's very important, and something that I always encourage women, because I really sense that very often it's much more psychological than it is physical. And it's something I always also experience, that you might be physically ready, to go back to the gym. You might be physically, and your doctor will give you the green light. But there's this fear, this fear that you're going to hurt yourself. It's this uncertainty. You feel the tightness, and you just feel like, and I felt it during many years, like it's going to kind of scratch open, and I think it's very important to have that discussion. And very often, as you mentioned, once the surgery is done, once the treatment are over, women are very often left alone with all these emotions, and they question themselves. They say, am I too weak? Should I just kind of toughen up? Is that normal? Is it not normal? To whom can I talk about this? So for us at the Cancer Coach, that's really a part of the journey where we intervene and where we offer a safe space to talk about it. And I'm always very open to share my journey. And I understand this whole, this psychological kind of step that you need to take. And it's about guiding also our clients to do it, at their own rhythm, step by step, try it out a little bit, and really find this confidence back and trust your body again. Because there is also a very much a mistrust somehow of the body, like the body let you down somehow, and to kind of find this peace again. And I think that, it's unfortunately not addressed enough. And it's very, very helpful if you have that kind of additional support.
Yes. Well, and everybody is different. I had some ladies who are like diagnosed today. They went, I want surgery in 2 days' time. And then 2 days later, the next day they go home. Next day they flew away to a different country for their holidays. Some people are like that, driven. Some needs to have the time to absorb. And also sometimes when all these things that's going on in our lives all settle down, that's when it's like it's time to sit down and have a cup of tea, and that's when the emotional things do come back. So it can occur at any point, and everybody's very different. Everybody's very different and how they react, and so that's why there's not a one size fits all approach.
And definitely, I have noticed that when you are caught into this, of days diagnosis, you have all these appointments, you have all this amount of information that you have to consume and to understand, and then all the decision has to be taken. Sometimes there is really no space for emotion because you are kind of just in survival mode. You need to just, do one thing at a time, and then it comes back to you afterwards. Yes. And that's where, yes, the emotion comes up, and it's like, and even I sometimes have this feeling, my God, this really happened to me. I mean, it's so surreal. Yes, so again, you never know when these emotions are going to come up, and it's important to have a space where you can talk about it. I would also like to ask our viewers to ask questions if they want. So I got a question here from a lady who is saying, after mastectomy, I experienced tightness. I exercise regularly in the morning, but by evening the arm becomes jammed and can't move all the way up or to the back. Why does this happen?
Well, after the surgery, this part of the healing process results in scarring, and over time the scar will tighten up. And that's why most ladies will feel this tightness. And it's very important to get the physio or self-physiotherapy or to get moving, because the longer you leave it, the harder it will be. But also at the same time, we cannot overexert ourselves as well. For example, I have one lady who works in the supermarket, and every day she lifts trays of goods as part of her job. And at the end of the day, she ends up having a swollen arm, the lymphedema, which goes away overnight. But it's important not to overexert, because what happens is that if you get this swollen arm, even though it goes away after a night's sleep, but over the long term, the body will know that, oh, how come the arm is getting heavier? So what happened is that the body will react to it by having a stronger bone, and also by having a stronger muscles to support the weight. And that's how lymphedema develops over a long term. It's not just a small, it's just not, maybe not one single event, but it's more of a long-term change as part of, as a result of the surgery. So it's very important not to overexert, is to exactly know what you can do, and don't overdo things, but certainly don't underdo things. So it's hitting it right, and that's down to when everyone will have a different point. And that's why I think seeing a physio or someone who specializes in this area, who sees lots of ladies, is tailoring, getting the right level, I think.
Exactly, and it's very important to find that right balance, because just resting it and not moving it, it's definitely not the right solution in terms of scarring, but overdo it, as you say, can also bring other problems. And just to quickly go back to when you talk about the lymph, so we haven't touched that. So you usually would remove the sentinel node, but when is there a need to remove more lymph nodes, and what kind of side effects can that have?
Right. When I first started my training 20 years ago, the treatment was to remove all the lymph nodes. But we know that removing normal tissue does not improve life, but can actually make things worse. And that's why, 20. Yeah, no. I graduated 25 years ago when I started doing my lymph node surgery. But about 20 years ago, we started looking into sentinel nodes, because we don't want to remove all the lymph nodes. And we do know that lymphatic drainage is quite regular, and we have now the technology to find out which lymph nodes to remove. And from this research, we know that that's the most likely one to harbor. So if there's any cancer in that lymph node, then we should remove the rest. And then the rest is really, well, how do you define that? Do you remove all the lymph nodes, like all 20 to 40 lymph nodes, or shall we remove a bit more? It really depends on the cancer itself, how the other lymph nodes feel like, and we make a judgment. And sometimes I do discuss with my ladies. So if the sentinel node is like this, so do you want me to remove all of them, or shall I just see, just remove to a certain point, you know? So it is down to a very personal discussion. Yeah. So the problem
can have long-term side effects, right? If you remove them.
Because it increases the risk of lymphedema, because the lymph is basically the tissue fluid that we all have, and these get collected in the lymphatic vessels, which then channels through back to the blood system. And at various places in our neck, our armpits, our groin, inside our tummy, there are these lymph nodes that are part of the immune system. So by removing these lymph nodes, we are obstructing the lymphatic flow. If you take all the lymph nodes out, then the chances of developing a lymphedema is 40 to 60%. But whereas if we just remove the sentinel node, the rate is less than 5%. But I think realistically, the risk is less than 2%.
And I think that's
a difference, yes.
Yeah, and I think it's really important again to that women have that information, that to ask the questions. You know, if they are asked, you know, we have to remove all the lymph nodes. To ask, is that really a necessity? You know, do I have other options? Well, how would that increase my risk of getting a secondary cancer if I don't do that? And you know, to make sure they have an informed decision and that they are able to at the end make the decision for themselves.
And of course, the lymph node status is very important in guiding the subsequent treatment, like, for example, radiotherapy and chemotherapy. There's certain cancers we know definitely needs chemo, but there are some that the hormone positive and HER2 negative cancers, not all of them need chemo. And knowing the lymph node status is very important to do that. And also, after mastectomy, we tend not to give radiotherapy unless there are cancer in the lymph nodes. If there are, then after mastectomy, ladies will still need radiotherapy. So there is a role in removing these lymph nodes. We cannot rely on the MRI, PET-CT, scan, mammograms, and ultrasound, because within the lymph node, there may be a small spot that has got the cancer in it. And because of that, the actual structure of the lymph node remains, and that's why all these scans will not necessarily show everything.
Okay. Well, I really appreciate you having taken the time, Dr. Lee, to give us all this very important information. And that's all, you know, we want to do. We want to shed more information to make women feel more at ease. And also those who have gone through a mastectomy, you know, to kind of take away the taboo around it. And many women still feel ashamed to talk about it. And it's, of course, a very personal topic, but I think it's the more you talk about it, the more, you know, women will feel at ease around it. And also sharing the information, you know, makes other women feel more comfortable. And I always get from my clients that when they talk to women who have dealt with the same experience, it's very helpful and very therapeutical. So thank you for being here today. And I want to remind our viewers that you can still ask us some questions. We will get back to you also after this. And go to our website, thecancercoach.org. And we talked about the importance of breast self-examination. So we have actually on our website a free self-assessment that you can print out to remind you about the self-examination. So go ahead and print that out. And otherwise, I'm looking forward to see you next week. Thank you so much, Dr. Lee, and I hope to hear from you soon too.
Thank you very much. Thank you.
Bye.
Bye-bye.